So a heel spur is basically a calcium deposit that causes a bony protrusion from the heel bone, or also known as the calcaneus bone. Heel spurs are commonly associated with plantar fasciitis, which is a painful inflammation of the thick fibrous band, the plantar fascia, that connects the heel to the ball of the foot. What causes a heel spur? So heel spurs are caused by extra tension or load to the plantar fascia under the arch of the foot that we mentioned before. Risk factors for this are a sudden increase in activity, in particular running, walking, obesity, just to name a few. A major precipitating factor in the development of both plantar fasciitis and a heel spur is a foot that rolls in or rolls out excessively, so a flat feet or a high arched foot. What are the symptoms of a heel spur? So quite often the heel spur itself can be painless, and it's usually the plantar fasciitis that I mentioned before that causes the pain. Either way, the pain associated with heel spurs and plantar fasciitis is generally described as either a rock in that area or a knife stabbing into the foot, and the pain is particularly bad first thing in the morning or when rising from sitting for a while. As the condition progresses, it'll often be painful all the time. Activities like running, walking will exacerbate it usually. How to diagnose a heel spur. So your podiatrist should be able to diagnose it quite easily just by palpating the area and taking a thorough history from you. To differentiate between plantar fasciitis and a heel spur, they may send you for an ultrasound or an x-ray, which will just give us a better idea. So what are the treatment options for heel spurs? First go-to treatment options are icing, stretching and massage. Footwear modification is a big one if that's a factor in the development of it, so getting you into nice supportive footwear with a little bit of cushioning in it also. If you do have one of those foot types I mentioned earlier, or a foot that rolls in or out too much, or a flat foot or a high arched foot, orthotics may be necessary and your podiatrist can fit you up with these.